Uh, Hello there. My name is Yasin Kuri, and my topic for today is healthcare policy. The reason why I chose this topic is because nowadays healthcare is the biggest problem that we all citizens of the United States are facing in this generation. And I would like to continue my slideshow. So when we start from healthcare policy is a rule of set. It's a policy that was set or that is set by healthcare officials and implemented by healthcare providers, which means the officials in the higher position implement these rules, and then later on, the healthcare providers provide these rules to the citizens or to the community. Uh, the next slide is this topic of the public health problem is that at any time someone may get sick. So healthcare is a mandatory for every citizen, like the four human necessities, which is food, clothes, shelter, and housing. So as of those four, healthcare is mandatory for all citizens in order to survive in this world. Healthcare service issue is a public health issue that knocks everyone's door, from rich to poor or from infants to elderly people. We humans are not immortal, which means we get sick from time to time or from day to day. So having a healthcare policy or a healthcare plan helps us to stay healthy and then to stay updated with our health status. Nowadays, life is becoming hard on everyone, with many citizens losing jobs or having underpaying jobs. And then on top of that, when healthcare services become expensive, it's hard for these people to afford it and provide the healthcare for their family. For example, people with less pay, family with a less pay, or family that lives from paycheck to paycheck is very having a hard time to afford health cares for their family members. This problem is connected with lower income families because those with higher income families have no problem affording the health care, while the poor family lives with fear because if their kids or a family member gets sick, since they don't have no health plan, they cannot afford to pay cash or to have a health plan. That is impossible to afford. The expensiveness of the healthcare service is giving a hard time to to the citizens of the United States. The other problem is that healthcare services are nowadays depending on the presidents. The reason why I say this is because every time a new president is elected, they like to reform the healthcare policy like how President Donald Trump did. There are many low income families that had Obamacare plan. But once Trump was elected, these families were thrown under rags with no plan for their kids. And this is a very hard situation for those families because since they have a low income, it's hard for them to afford this health plan. And the other one, or the final slide of my PowerPoint, is that how can we overcome these healthcare problems? And the first one and the most important one is that to have or to increase the number of affordable health cares so that the low income families or the middle classes could afford it. And the second most important step to overcome this healthcare problem is to give annual training for the healthcare professionals because once these healthcare professionals get appropriate training, they could have a close relationship with the community, and then they can update the community with their daily health plan. And the last but not least, which I believe could overcome the healthcare problem, is that government should work closely with the departments of health and human services to lower the cost of healthcare for the citizens of the United States, which means the departments of healthcare and human service is the healthcare that cares for the citizens, but however, they have to have relation with the governments so that they can help the community at all costs and have lower healthcare for all the citizens of the United States of America. Thank you.